Customs Service has begun implementing a 2-year exemption on import duty and value-added tax for key pharmaceutical raw materials. This was disclosed in a statement on Wednesday by the NCS National Public Relations Officer Abdullahi Mayawada, an assistant controller of customs, said the policy follows President Bola Tinubu's approval of guidelines to support local pharmaceutical manufacturing and reduce healthcare costs. It stated that the tax exemption applies to active pharmaceutical ingredients, excipients, and other essential raw materials used in producing medicines, long-lasting insecticidal nets, rapid diagnostics kits, reagents, and packaging materials. According to the statement, the move is in line with the presidential directives to enhance local healthcare manufacturing, reduce production costs, and attract investments. The guidelines were approved by President Tinubu, but through the Minister of Finance and Coordinating Minister of the Economy, Wale Edun. In commitment to transparency and effective monitoring, the NCS will compile quarterly reports detailing all importations under this policy, including data on importers' quantities and values of the imported items, ensuring the policy's implementations aligns with its intended objectives, the statement reads. Do we say this is a move according to Wale Edun that the president is trying to, put in place the health sector like he has actually proposed? Do we have to clap over this situation, please?
First and foremost, I want to say, if we talk about paper representation, we must be applauded again and again. But for me, implementation has always been a problem. On paper, it is not a bad, it's a very laudable move to be implemented, an idea that I think is good and is okay. It's long overdue because a government will ask yourself, with the kind of funds that the political class are wielding here and there, are showing off on a daily right in front of us all, you ask yourself what the government should spend money upon than trying to subsidize things like this, research work, drugs, locally made, or even imported ones, so that Nigerians can afford them. Because the society, the environment already, by the economic policies of government, the life expectancy of Nigerians are reducing. And out of stress and thinking, people are getting depressed every day. Sicknesses are increasing. We just talked about data increment in the way it went. The other day somebody was saying that somebody has hacked their phone. Somebody is just sharing their data with them. And I told them, no, nobody's sharing your data. The information is this. And everybody just, what you just say is lamentations here and there. So what I would like it or yes, I think it's important that the Ministry of Health looks at this and does something about it. And the best way to look at it and do something about it is by ensuring that it is not enough to write. It's not enough to talk. It's enough to get these things implemented. Put these things, get these things working. Let people see to it that something is happening. As it is today, everybody just feels that nothing is happening. It's like we are in the bottom low, all-time bottom low. It's like we have crashed completely as a people. And it is out of the fact that we are a religious country, and by statistical analysis, we are the most happy people in the world. Outside of that, but Nigerians really don't really look at government and its policies and day-to-day happenings to have something to celebrate, to have something to applaud themselves about. So it's a pity, it's a painful one, but I think it is something that the government of the day must ensure that this one scales through. There must be interventions for importers. There must be interventions for manufacturers that should encourage people to do what they have to do to see to it that the common Nigerian, the average Nigerian, is able to access life, basic amenities of life, most especially drugs at this point in time. Like you can say for without minusing words, quoting the former administration, the president left Nigeria to go and check his ear. That is how bad the medical system is here in Nigeria. So for those of us that do not have the opportunity to go to outside the country to go and check our ears, we saw a Nigerian musician who said he travels abroad to go and charge his phone. That is how funny the system here can seem. So we have to now see to it that when policies of these natures are being canvassed, we should see how we can assist government to see to it that they keep to their word and they get it implemented.
Thank you so much.